Can you hear me?
Yes.
All right. They say we're waiting on attendees, right? No one's in the waiting room.
No, we have someone here. Yeah, we have some people
Oh, we can get started.
here. Well, no, Kaja, yeah.
Yes, so good morning, everyone. Thank you for joining us today for our kinship home licensing information session. And we will have Dr. Valerie Jackson with Monarch Family Services that will be facilitating, as well as Mrs. Trinell Jones with Pathways. So I will now hand it over to Dr. Jackson to get us started.
Good morning. Good morning. I just want to start the session with saying Happy National Kinship Care Month. September has been slated as the acknowledgement and the sacrifice and services of kinship caregivers. And I wanted to start the session with those that are kinship caregivers saying thank you so much for stepping up and providing care for your loved one. We couldn't do this work without you, and you're extremely important in the child welfare paradigm. So, want to acknowledge first and foremost the National Kinship Care Month. All right, so we're going to go into our session. We hold these monthly sessions every month, well, monthly sessions, but we hold it every month, and it is to provide more information on the home licensing process so that you can make an informed decision as you move forward with getting licensed, also the support and the resources that come with licensing, and other services that you might find useful. And so, who brings this platform or this talk to you guys is Kinship Advocates of Texas. We are a group of supporters of kinship care, and we come together in order to make the climate of child welfare more conducive for you as caregivers, meaning that we know historically it wasn't a kinship providing or kinship entity, but we want to make, as we're utilizing kinship care more and more in the child welfare system, we want to make sure there's equity and that you're able to understand what you're committing to. And so we advocate for our kinship families, and we come up with solutions to any challenges that we have identified that prevents you from successfully providing the care and getting the support that is needed as you take care of the child or your relative. Um, like I said, we host these monthly, and it is typically typically a it's me as a host or either one of the CAT members as a host, and then we feature a agency so that way you can learn more about their program or their kinship program. All right. Um, Before we get into this talk, I wanted to go over key terminologies so that you understand the language as as you hear terms throughout this presentation. So I've already used the term kinship care several times. This is a person that is raising, or a caregiver that is raising a child. Could be an aunt, could be a grandmother, a cousin. It could be extended family members um, and that have been identified and is willing to take care of a child in which CPS has removed and is identifying placement for. A fictive kinship caregiver is someone that is not related to the child. But they've either been a part of the or they know the family or knew the child prior to CPS involvement, and they've provided and they've been identified again as someone that is significant to the child, and this person has stepped up and decided to accept placement of the child after CPS involvement. This could be a neighbor, a best friend of the parents, a coach, a teacher, um, a church member. So it could be anyone that knew the child prior to the involvement of child welfare. Unverified kinship caregivers or are caregivers that are not involved in the licensing process. However, there is CPS involvement in the child's case, but they have not gone through the foster or adoptive license. A verified kinship caregiver is CPS involved, uh, that are provide care for a CPS involved child, but the caregiver is licensed. And so they've gone through the process and able to um, they're able to provide care, but also get the supported services. Kinship reimbursement payments. It's a payment that is received. It's not a license. It's not involved with the licensing, but this is for unverified kinship caregivers. Typically, when they initially take placement of the child, they will receive a stipend of 23.45 a day per child for 12 months. It's time limited, uh, but it's support in the initial stages of the case. But we will talk more about that when we talk about kinship reimbursement, so you can understand the eligibility of this reimbursement. Reunification is when the child returns to the parent. So the child that had with the CPS involvement, or the family that had CPS involvement, the determinant is that the parent has successfully completed all requirements and is now um, safe to continue to provide parental care of the child. Permanent managing conservatorship, you're going to hear acronyms like PMC, is when kinship or fictive kinship caregivers um, are legally responsible for the child. So this is at the end of the case. So this is when guardianship is determined. A child will not be removed from the kinship or fictive kinship home and will remain until adulthood as the pri in the in as the under the care of this kinship or fictive kinship caregiver. PMC or permanency care assistance is after PMC benefits includes monthly financial assistance. So this PMC, I'm sorry, PCA, I say PMC, PCA, permanency care assistance, is the monthly stipend after PMC is granted. So after guardianship is granted, the CPS case is closed. The child still will receive a monthly stipend in order to support, the continued care of this child. Now, adoption, which we'll talk about all this stuff again. This is just as we use terminologies, you will understand what is being said. But adoption is when parental rights will be terminated, and the guardian has the opportunity to legally adopt the child, and so it creates the permanent parent-child relationship, and the and then the at this point the child can do a name change or whatnot, and so this is the adoption process. Could be an option in your case. Adoption subsidy is after adoption benefits. Or I'm sorry, this is after the adoption and the benefits, the monthly financial stipend, the health insurance is available until the child is 18. And so this is the subsidy or the benefits that comes after adoption of the child. So with PMC, you get permanency care assistance after guardianship is granted. With adoption, we call it the adoption subsidy. Pretty similar in the benefit packages, but we will expound upon that in the course of the presentation. And then finally, if you hear me say waivers and variances, these are exceptions that are made with compliance to licensing rules. So in the licensing process, there is checklist items in certain standards that you have to follow. In some cases, we're able to waive our request of variance for the standard. And so I will talk about, you'll hear me say waiver or variance in the course of presentation. And so these are the terminologies that you will hear again when in the course of presentation. Again, we go through this so that way when I do state it, you understand what I'm talking about. All right, next slide, please. All right, the child's team. So I want to point to the different members that make up a child's case. One is the CPS caseworker. Sometimes the kinship worker, sometimes the kinship specialist, or sometimes they're called the permanency specialist. Just depends what area of the state you are in or what type of um, involvement that you have with CPS. And so again, it could be this is the state representative that is helping and guiding you through the CPS case. They can be called CPS workers, kinship specialists, or permanency specialists. The next is the child's attorney. So if it's a conservatorship case, meaning the child is in CPS, um, um, is in the custody of CPS, then the child will get an attorney because they need representation because now it's this case goes before a judge, and so the child will get an attorney. Sometimes attorney, you'll hear the term guardian ad litem, and so, but that still is used interchangeably as the child's attorney. Next is medical and the mental health providers, and these are the individuals that you select to provide mental health and medical services to the child. Of course, the biological parent and other family members are involved in the child's life in the case. Child placement agency are the agencies that help with the home licensing process. These are private entities that are contracted by the state of have a contract with the state of Texas in order to help you with the licensing process and other supportive services. CASA and child advocates. Some cases have CASA and child advocates. These are volunteer supporters of the case. They help with just being part of the tribe that helps with guidance and support the family, and also acts in the best interest of the child and gives advice and to the or informs the judge on certain things regarding the case, and they're just more or less like support to the family. Then, of course, the family court judge is another team member, and then finally, relative. The most important role is the relative, effective kinship family that provides the care and support to the child. I said we're going to repeat some of the terms we talked about. Well, at least the terms are coming up in the presentation. So first term that we talked about when we were going through the terminology was unverified caregivers. So these are caregivers that are taking care of a child that is in CPS conservatorship. CPS has approved them as the primary caregiver. However, they are not they have not gone through the licensing process, and so they are not receiving the foster care stipend because they have not gone through the licensing process. But the child remains with this caregiver and provides and the love and support is provided. But child is in conservatorship, but but not going through, not gone through the licensing process. Next, okay. Unverified caregiver. So this is, again, those that did not go through the licensing process. They could qualify for the kinship reimbursement payment. However, it is an income-based payment, meaning that the household can't make over a certain amount. And the way I know it's kind of confusing, but you can't make more than 300% over the federal poverty. So I did give an example here. So if you have a family of four, then that means that the whole entire household, all working members cannot make over 93,600 in order to receive this stipend. And so that's the cutoff. So if every member in the household that is working makes more than that, you do not qualify for this stipend. Again, this is for unverified kinship caregivers. So this is not part of the licensing process, but this is a payment that you could qualify for. All family members in the household at work, income is included in this final tally. If you qualify, there is a monthly payment of $703.50 that you receive a month per child, but it is time limited. So the typical stipend is only 12 months. Sometimes, if the case is being extended, or maybe you are going through the licensing process, you can ask for a 6-month extension with receiving these funds, but that's it. And so again, it's income based. The kinship reimbursement payment is income based, and it's time limited. Okay, so income based and time limit is really what you should remember about this talk. All right, another financial subsidy that your family could qualify for is TANF. TANF is a one-time payment of $1,000, and it's just to help buy initial items for the child that's been placed in your care. But TANF also is specific. It has to be a grandparent, great-grandparent, or great-great-grandparent in order to be eligible for this one-time uh, TANF grandparent grant. And again, it's to help with the initial needs of the child. Now, verified kinship caregivers, what they do get, once you're verified again means that you have gone through the licensing process. You have worked the steps, you have completed, you've been approved, and you are a licensed kinship caregiver. Reimbursements payments does not, it's not income based, so it doesn't, so you can make $1 a year or you can make $1 million a year. You will still qualify for the licensing process. And so there is a pathway that you must follow that you'll hear about in a minute, of how to get through the licensing process. But once you have completed, then you are a licensed caregiver and you have access to the kinship payments, and I'm sorry, to the foster care payments. And it's not time limited. So if the case is a year, then you get it for a year. If the case is 2 years or 3 years or 4 years, you still will get it every month. And it's a higher rate than the kinship stipend. Also, once you're a licensed caregiver, it does provide the pathway to permanency, meaning that if the child remains in your care, the child will be able to, you'll be able to achieve permanency through either PMC, or permanency managed conservatorship, PMC, or adoption, and then which will also open up for the post permanency benefits of monthly stipends, medical insurance, college tuition reimbursement. Again, we'll talk about a little later, but so it opens up that opportunity once you go through the licensing process. Now, of course, you are required to meet certain standards for verification. And right now, the standards look similar to those that are not kinship caregivers or are strangers to the child, but those standards are modifying in the near future. But right now, they're still the same. Um, but again, it does the licensing process is not time limited. It is a higher monthly payment, and it opens to the pathway of permanency for you to receive a monthly stipend, medical insurance, college tuition reimbursement, and post-permanency services after you've achieved adoption or PMC. And so that's extreme. That's a really extreme incentive to go through the licensing process. All right, permanency managed conservatorship with permanency care assistance. This again is again the terminology we talked about in the beginning, and so the CP again, has CPS involvement. Child's placed with the relative caregiver, but it's determined that the child will not return back to the biological parent, but parental rights will not be terminated. And so, because there's no grounds to terminate parental rights, but in the best interest of the child to stay with the kinship caregiver. And then the kinship caregiver can get what's called PMC, permanent managing conservatorship. Also, you may be familiar with the term as guardianship, and so they can get that. And so after PMC is granted by the judge, then you're because you went through the licensing process, you are eligible for the permanency care assistance, which is a monthly stipend, medical insurance, college tuition reimbursement, until the child is 18 years old. Also, you are eligible for post permanency services and supports. Though post permanency services support is optional, but it's available, meaning that you don't have to engage in post permanency services. It's highly recommended, but it's always there if you need it. From in the course of the childhood and adolescent periods till the kid is 18. Now, you're required to be verified to qualify for this PCA benefits, and that is the verification process is the licensing process. Adoption is again when we have determined, our judge has determined that parental rights will be terminated. So they're going to terminate parental rights. And at that point, the child is legally free for adoption. And so, uh, what the stipend covers, or the adoption stipend covers, is it does cover the legal fees that are that come with the adoption process. Also, adoption assistance, so the monthly financial stipend, medical insurance, college tuition assistance after the adoption is granted, post permanency support or post adoption support. And again, the only way you can have access to this package of benefits is if you go through the licensing process. And so again, you get the monthly financial stipend, medical insurance, college tuition assistance, and all these benefits when it comes to this becoming licensed. Next slide, please. Adoption assistance. And so there's some qualifiers that I want to make you aware of. So eligibility for adoption assistance, uh, the child must be 6 years or older, or must be 2 years or older if they are part of a racial or ethnic minority. But if they belong to a sibling group, then the age is waived and the child still qualifies for the assistance. Or in some cases, if there is a disability, handicap, mental, physical, emotional, then the child could qualify. So again, some of the eligibility for children, 6 years or older for the adoption assistance, 2 years or older if the child is part of an ethnic minority group, or if they belong to sibling groups, are diagnosed with a disability. The length of adoption assistance is until the child's 18th birthday. If the child leaves the home or the family no longer provides care to the child, then or the child is removed, then the adoption assistance ends. But as long as the child is in the care of the caregiver, then the caregiver will receive adoption assist or the child will receive adoption assistance. Next. All right, we're gonna pivot a minute and take a mental break from the information. I'm going to go ahead and give the floor to Nakaja for our icebreaker.
All right. So we hope everyone is still awake. We know this is a lot of information to take in. I do just want to bring to everyone's attention that we do have the chat feature open. So if you would like to ask any questions, you can drop them in the chat. We are monitoring the chat. And so before we go into pathways to kinship home licensing, we wanted to do an icebreaker with you all. And so our icebreaker for today is, what is one thing on the very top of your bucket list? So, what is one thing that you may have at the top of your bucket list? So what is the one thing that you've always wanted to do and you're like, I'm going to do this one day? So, if anyone would like to share in the chat, what's at the top of your bucket list? All right, so remodeling your home, absolutely. I would say at the top of my bucket list is just organizing my home. Okay, travel, also remodeling. All right. Oh, nice. Well, thank you all for sharing with us of one thing that's at the top of your bucket list. So if you didn't get to share anything, not a problem. Just keep that in mind of one thing that you have on your bucket list. And just like McDonald says, it can happen. So we will now continue with our presentation. And now we will have Trinell Jones with Pathways Child and Family Services that will now present over the pathways to kinship home licensing.
Thank you. Hello, everyone. Thinking about my answer to that icebreaker there, I think for me, vacation is next week. So that would be my bucket list right there. We're going to start off talking about the pathway to kinship verification. First, starting off with step one, select a child placing agency within your area. Your kinship caseworker should provide you a list of child placing agencies, also abbreviated as CPA, in your area. You can also do this with a Google search as well to make things a little bit easier for you if need be. When talking about that, the caregiver should determine which agency is best fitting for their family, making sure that it aligns with exactly what you need to be done in regards to the permanency goal. That it also meets just your needs, as making sure that you can communicate well with that agency as well. Lastly, the caregiver should contact the agency to schedule the initial orientation. It would be something like today, going over exactly the routes to, like Dr. Jackson mentioned, the PMC, PCA, adoption, things of that nature, and exactly how does that agency go about doing that. Now talking about step two, attending the initial orientation. So like I mentioned, during that agency's orientation, we will talk a little bit more about the expectations required for becoming a licensed caregiver for one of the following programs: Foster to Reunification, Foster to PMC, Permanent Manager Conservatorship, with that PCA, that adoption, the conservative subsidy, Foster to Adopt, and straight adoption. Orientations may vary between agencies. Normally of the time they are offered virtually like we're doing this morning. If need be, agencies can do it one-on-one or in person. You can go to that office and they can talk to you face to face if that's what's preferred. Okay, now going into the background check. So the agency that you will select, they are required to run a background check, a criminal history and a fingerprint-based central registry as well. This is a requirement for all of the applicants. So every caregiver, any household member over the age of 14, frequent visitors to your home. So if every Sunday you're hosting family dinners, anyone that comes to your home on a frequent basis, they will need to be background checked, along with babysitters. So I basically define babysitters to be more of a contingency caregiver, someone that will support you in the time of need. If you're running late from work, if God forbid you have an emergency that prevents you to assisting the care of that child, this person will step in. So just start thinking about who that person would be and make sure that they are comfortable with doing a background check. The background check and instructions will be provided by your agency, so don't feel overwhelmed to figure out the steps by yourself, but the agency will walk with you hand in hand to get that completed. In the event that there is criminal history, we have to do what is called a risk assessment. The state will require us to give them more information regarding a specific charge or charges. So, for example, if you were in your adolescence or young adult years and you had some wild times, and you got into some trouble, we possibly would have to give more information to the state in regards to that charge. So it depends on exactly what is being questioned when doing the background check. However, your agency will be able to walk with you hand in hand in regards to completing the background check and the risk assessment as well. Okay, now we get into a little bit more of the nitty gritty here, talking about the home file paperwork. So all agencies, they will follow the same state requirements in regards to documentation. So we want to have the identifying information. This will be your driver's license, social security card. For the children who are 1 year up to 18, we want to have their birth certificate as well. Moving on to the auto insurance, any vehicle that you would transport the child to and from, we want to make sure that we have auto insurance on that vehicle. Marriage license, divorce decrees, and death certificates. So if you are currently married, but you've been divorced twice in the past, we need to have your current marriage license and your 2 divorce decrees. If that's not applicable, maybe because the first husband passed away, we have to have the death certificate of that as well. For pet vaccinations, this is for our cats and our dogs, and I believe ferrets. I'm not really sure why ferrets, but we do need to have the pet vaccination just to make sure, specifically the rabies vaccination for those animals. Domestic violence statement. So within the past 24 months, have we have any service calls or emergency calls to this address? Want to make sure that we are knowing exactly what's going on in the home as well. Tuberculosis testing. So every household member will need to be TB tested. Moving on to the health statement, this is an overall comprehensive kind of form that you will fill out to give us more information of your health status. So if you are on medication for blood pressure or if you take muscle relaxers, we need to know these things, that way we can make sure that we don't need to dig a little bit deeper into that as well. For example, if you do take muscle relaxers, we will have to get with the prescribing physician just to confirm that when you do take the muscle relaxers, this is not imposing on your ability to parent, right? Normally, majority of the time, the muscle relaxers are Schedule II medications. So we want to make sure that we have all the information just to make sure that we have the health side of things as well. Moving on to the weapon and firearm inventory, we do have to have all of the weapons on file. So if you are big into hunting or whatever the case may be, we do need to have that. We do include any darts, arrows, or BB guns. So just making sure that we have a full understanding of what exactly is in the home. Okay, now we made it to step 5. So this is more of the training. You're going to take right at 30 to 35 hours worth of training. There are sections into instructor-led training, such as a Zoom call like this. And then it's also self-paced or self-instructional training. So, for example, the pre-service, this is a requirement for all agencies. The pre-service is a packet worth of training that every applicant will complete. It talks about various topics such as normalcy, reporting serious incidents, water safety, disaster and emergency planning. So this packet of training you will get is going to be possibly through the instructor-led training. We offer it here with Pathways. We offer it on Zoom. And so, like they mentioned, if you're not able to do it over Zoom, you can also ask to do it in person as well. You just want to confirm with your agency. In regards to the self-instructional training, this is something that you can take your time to complete. So they're going to give you all the information, the links to the training, as well as any tests or comprehensive exams that you have to complete towards the end. So you want to make sure that you have all the resources. That way you can take your time, maybe your Saturdays such as this, and complete all those trainings. This is also in regards to anyone who will have unsupervised care for the child. So remember earlier, I talked about having that babysitter, that contingency caregiver. They will also be required to take sections of the pre-service training as well. General topics across most agencies will talk about, like we mentioned, the trauma focused topics, human trafficking, online DFPS trainings, that would be a part of your self-paced trainings, and then CPR and first aid. From my knowledge, that would be the only training that you would have to do in person, right? So CPR, first aid, we want to make sure you do know how to do resuscitation, things of that nature. So you will have to do that one in person. That also goes for that support provider, that babysitter as well. They will have to complete CPR and first aid. Okay, so the home inspection. So you will have someone come out to your home. Let's backtrack. If you complete your application, you decided on an agency, you did the orientation, you've done the application, and you've selected, and you're ready to kind of get to work on everything that we talked about. That agency is going to assign you a home developer or an agency representative. That person is going to come out to your home at least twice. So at the beginning, just to see your home, to see the space, and also at the final walkthrough to make sure that we have done everything to being compliant in the eyes of a foster home licensing. That agency representative will verify that the home is clean and safe for children. So we want to do a full walkthrough of inside and outside of the home, right? We want to make sure that in the kitchen we have running water, we have a fridge that works, and everything in the fridge is sealed correctly, right? Then we're moving into the bathroom. Is there paper towels and toilet papers available for the children to use? Is there any concerns around the home? Do we have any holes in the walls, things of that nature, just to make sure that the home is a safe environment for a child? Like I mentioned, this will be covered in the inspection that every agency would do. So the fire safety and environmental checklist, everything that I mentioned is what's going to be on that inspection. For the fire safety, we're looking for smoke detectors in the hallways leading to the bedrooms and also in the bedrooms as well. So just to make sure that you already kind of have an idea of what the inspection looks like. It's not a test. We're going to make sure we're not passing it. We're going to walk around and say, okay, we need to do this, we need to do that, because we want to make sure that you are able to pass that inspection at the very end. I talked about a little bit before, but sleeping area of the children, they will also be observed. So we want to make sure that every child in care has at least 800 square foot of sleeping room. That includes having a bed and a place to put their personal belongings. So making sure they already have a space within the home and their own room to where they have a bed and the dresser, possibly a desk, and things of that nature. So just making sure that we're able to walk around and see that for ourselves is very imperative. Next slide. Okay, final review. So you've done all of your trainings, you're now CPR certified, you work to do your background checks, everything is eligible. You're now on the right track to get everything ready. You're ready to move into that permanency that Dr. Jackson talked about. So the agency will review the completed home file, right? We're going to double check that we've done everything, we follow standards requirements, and we're in the green light, we're ready to go. There are various criteria that a home file must meet to be considered for the Ready for the Home study, and that all depends on the agency. Every agency is different. So I know for here at Pathways, and I can believe the same for Monarch, is that we want to make sure that the checklist that we gave you, that we have every single item that we need and it fits the requirements. Once the requirements is met, the family is referred for a home study. Agencies can submit waivers or variances for certain standards or rules your home may or may not meet. So if your home does not meet the requirement, maybe we're shy of the 800 square foot need, right? We have a room, it's a nice size room, but it doesn't meet the requirement. we can fill out a variance. I just did a variance for a family to where it was a dire need where the kids came to live with their grandparents and they only had a 2-bedroom home. And the second bedroom was used by their elderly mother. So they had to do a variance for the children to be able to be in the dining room, right? We have to work with the state to put up we put up long curtains and we gave a divider for the kids. That way it separated things out. So we have to make sure that we have things in place to support the need for a variance as well. All right, now you made it to the home study. So this home study, the foster and adoptive home study, is very similar to the kinship assessment and study that you guys will complete when CPS places the child in your home initially. Now, this interview can take a full day. It can be from 2 to 8 hours. This all depends on the number of people in the home. So if you have a married couple and they have their parents living with them and other people living in the home, every single person will need to be interviewed as well. So we want to make sure that all household members are present in the home for the interview. You want to make sure that you're being honest and forthright with the responses to the question. The way I describe this assessment, it is a overview of you as an individual, your life, and also your home as well. So if anyone wants to read it, they are able to kind of fully grasp who you are as a person and your ability to care for the child. There may be follow-up questions. Remember, we want to make sure that we're getting things right because this is a sealed document that we have to submit when we're talking about permanency. So we want to make sure we have things correct. And so we might have to come back and ask follow-up questions just to make sure things are together. We do talk a little bit more about references. So references will be completed in different ways. First, starting off, if you have biological children, anyone over the age of 18, they will have to complete what is called an adult child reference. We want to know from their standpoint, their experience of your parenting, right? You're presenting to us to be this very noble and nurturing parent, but your child did not have the same experience. So we want to make sure that we're hearing their viewpoint when it comes to parenting from you. Also, having the additional 3 references, they will be contacted within your application. They will ask for you to list down 3 character references. So, one relative that can be a parent, a sibling, an aunt, or a cousin, and then 2 non relatives, someone that can speak well about you. So, I've seen people use their pastor, their coworker. I had one person use their mailman. They're really close to their mailman. And so it just depends. Anyone that you know have seen you go through this journey of having the children in your home, working with CPS, and they can speak well about how you are taking care of things at this current moment. Okay, so now we're at step 9, the final verification. So we talked about the home study, how long it could take to get it done, but it also, on an average time frame, it takes about 3 to 6 weeks for it to be written. Remember, we're making a very large document of exactly who you are as an individual. So we want to take our time to write this out. Once the assessor submits the home study, it is reviewed for approval by your agency. Once the approval is given, the home is open as a licensed home for the following. So foster for unification, foster to permanent manager conservatorship, foster to adopt, or kinship straight adoption. So your license will be given onto you, and then we can move on to the next part. We're talking about opening a home and moving into the date of placement. Okay, so now your home is open. The dates of placement. So I know the children have possibly placed into your home, but the date of placement will be when we as your agency come out, and also CPS will come out, and we will say this is your date of placement. That date of placement is very imperative because that will be the day that your daily reimbursement starts. So like Dr. Jackson talked about before, is you have all of these benefits that you are able to receive. You're not eligible for because you went through this process, and so that's why we work with CPS to come up with a date that way we can go ahead and have you be accruing that daily reimbursement. Once you have your home license, you want to make sure that you have that posted in your home at all times, not only because this is a proud moment for you as a caregiver, but if something was to happen where we have a random inspection from the state or things of that nature, they do need to know that this home is verified and licensed through a actual agency. This talks about the kinship verification reimbursement. So like we mentioned, reimbursement provides up to $750 paid to a kinship caregiver after the completion of a foster home verification. That does not depend on your salary, anything like that. You're automatically eligible because you're going through an agency being verified. This can offset the cost associated with the verification process and any care that you're giving to the child. The way we teach families is it is a reimbursement. So you are putting it out and getting it back in the end. So you don't want to say, okay, once I get the 750, I'm going to do this, I'm going to do that. You want to make sure that you're already taking care of the child and you're being able to reimburse yourself later in the future. So making sure that we're still feeding, we're still clothing, we're still bathing, we're still tending to the child. And once we get the reimbursement, we're reimbursing ourselves to keep going forward for the care of that child. Step 11, ongoing home monitoring and support. So as I can imagine, a lot of kinship families, they are already receiving their monthly visits from their CPS or DFPS caseworker. Now that you are licensed, your agency is now involved in that as well. So they will also do their monthly visit to your home, and just to make sure that we are staying in compliant, and then also that you as a caregiver and the child, you're doing well in this placement. We want to have a home inspection. So every month when your agency worker comes out, they're going to walk through the home. They want to see the child's room. They want to make sure that what we had set up the date that we license you is still running and nothing has changed. If something has changed in your home, maybe we did meet our top of our goal and we have remodeled our home, then we need to come back to the drawing board, do a floor plan, things of that nature, just to make sure that we're always up to date to what is happening in your home. Just a reminder of that, just to make sure that you understand that we're licensing you as a caregiver, but also your home address as well. So that's why we kind of give a little bit more information to your background and also the home information and get into that process. Sample inspection from the residential child care regulation inspector. So as I mentioned, sometimes we have families that are licensed and the next 2 months they have a random inspection from a child care regulation inspector. That doesn't necessarily mean you did anything wrong. That is more so for the agency to make sure that they're on their P's and Q's. We want to make sure the state wants to make sure that agencies are developing homes that are fitting to the requirements of the state. And so this is why we want to make sure that we're coming on a monthly basis so that any given time that they may come out, we know that we are confident in what you have because we're checking on it consistently as well. Caregivers will submit monthly progress reports to update CPS worker and also your agency caseworker. So with Pathways, we do require our foster parents to complete a monthly medication log. So any medication that you're giving over to the child, we want to make sure that we have that documented, and also our foster parent log. This is something that you would submit to CPS as well. The foster parent log is the way I describe that is to give you an overview of your diary of how did you take care of the child for that month. So for the month of August, we're getting ready for school, but we did our final vacation and things went well. The child did have a scheduled visit for their bio mom, but she didn't show up. So that kind of set us back emotionally. So you're giving us a depiction of what happened for the month. That way, if any given time we are questioned about our ability of what have we been doing to tend to that child and care for that child, we have monthly documentation to support that on your behalf. Next slide. Okay, now moving into that permanency. So we went through a little bit earlier about each and every single one of them, but now that you have that your license, you are eligible to move forward to that permanency. So reunification, the child returns back to their biological parent. Permanent manager conservatorship. Now that you are licensed, you are able to do the 6 months as a foster parent and you qualify for the permanency care assistance. This would be benefits that will be eligible to the child all the way up to the age of 18. So that's monthly financial assistance and healthcare coverage for the child as well. On the other side of that spectrum, we have adoption. Once the biological parent's parental rights are terminated, the legal process that permanently joins the child to the kinship or fictive kinship family. So that child, you guys, I've seen people have like parties at the courthouse for this. This is a big moment, a joyous moment. The child is yours, and consummation day should be a joyous day for anyone to be a part of. After adoption is completed, the child is able to be a part of the adoption subsidy. As we mentioned before, there are some requirements for that as well. So when we're having that conversation with you as a caregiver and your CPS worker, They will let us know that rights are going to be terminated, and they're going to work with you on the adoption subsidy and negotiations of that. And I think the following slides talks a little bit more about that. Okay, so post-adoption and post-permanency services. So once permanency is reached, you still do have services that can aid you into the caring or just the family bonding for you and the child, parent education, support groups, counseling. So we don't want you to assume that I've done all this hard work, I had a team of people to support me, and now that I have my permanency, I don't have anyone, right? You still have access to all of these resources. So please make sure this is the perfect time to take a picture of this slide, because these are support things that you might need in the future, right? The child is currently 18, but the behaviors at 8 are different at 18. So we want to make sure that you do have the idea of the resources that you have available in your back pocket. Okay, these are frequently asked questions in regards to the home licensing. So what is the typical duration of the licensing process? So generally, most agencies can guide the family through the process within a time frame of 3 to 6 months. That all depends on the process itself and also the willingness of the caregiver. So if you're starting, you're hitting the ground running, and then you kind of get to a barrier and you become stalled out, then you can also style out the process for yourself. So you want to make sure that you're keeping up with the stride, right? You're giving the energy, you're responding to your agency, because more than anything, your agency wants to support you in reaching that permanency for you and the child. We talked a little bit before about the financial benefits for foster care and adoption. But just to kind of go over again, on average, you can receive approximately $854, while the adoption subsidy and the PCA average is around $400 per month. So there is some benefits to being a part of the licensing with the agency and also having that financial reimbursement. There will be changes to the medical insurance following adoption. The child will still be covered, but for right now, children that are in care, they are on Superior Health Care, Superior Health, which is the foster care Medicaid. Once they do transition to their permanency, they will be transitioned into STAR Medicaid plans. So they will still be covered. It will just be a little bit different in regards to the terminology and the name for that insurance plan. If you are married but separated, you have a criminal history, or you do not have legal citizenship, are you still able to participate in the home licensing process? Yes, and absolutely. You want to make sure that once you have narrowed down the agency that you're willing to work with, that you have that conversation with them from the get go. We don't want you to go through all the trainings, all these inspections that we talked about, and then we're ready to get you to that home study assessment, and then we run into this barrier. So you want to make sure that you're being, vulnerable with us from the get go. That way, we can assist you in exactly what you need to be done. Okay, frequently asked questions again. So, what expenses should I anticipate during the home licensing process? So, child placing agencies typically do not impose fees. So, all the trainings that I mentioned, all the inspections, everything is pretty much going to be covered through your agency. However, families may need to cover costs for the fingerprint, for the caregivers and the household members, anyone over the age of 14, the safety equipment. So that would be the fire extinguishers, the smoke detectors. You can work with your CPS caseworker, and they can supply those items as well. And then the TB test. Some agencies may cover the expenses. We try our hardest to cover our fingerprint costs for our kinship families, and along with providing fire extinguishers as well. Um, Anytime you are having to do things on your own financially to get these things covered, you can work with your CPS worker, and they can reimburse you up to $700 after the home is active through the kinship verification program. How many training classes am I required? So again, you're going to take right at 30 to 35 hours of training. Majority of this is going to be in a virtual format. So we're going to provide you dates and times that we have available for you to complete your training, and you want to schedule yourself accordingly. If that doesn't work, you want to get with your agency to see if there's a way to do it in person or to come with a different schedule that might be fitting for you. After achieving permanency, will there be visits from people in my home? That is the biggest question that we get. A lot of kinship families is like, it's so many people in my house and I want it to stop. Once you achieve permanency, all of that will stop. However, remember, you still do have access to the post-adoption or permanency services. So maybe you don't need anyone to come and look in your home, but you just still want to continue therapy. You still want to continue your parenting support groups or classes. You still have access to that. And so we want to make sure that you still have the resources for that, just in case you're wanting to sign up for that as well. All right, so this is a summary of the pathway to home licensing. Again, I will give you a recommendation to take a picture of it here. It's a lot going through the process, but every time you're doing documentation, trainings, you're moving from one step to the next. So if you have any questions, we'll look forward to assisting you guys further. Thank you so much.
All right. I'm going to stop sharing screen, and I'm going to share my screen. Right. So today for National, for the month of National Foster Care Month, we again celebrate you. Uh, Today's featured agency is actually the one that I am the founder and CEO. It's Monarch Family Services. We are actually uh, um, accredited as a Kin First child placing agency with CARF, and so we our focus, our mission, our all work is uh, definitely geared towards bettering the child welfare climate for kinship caregivers. And so the mission is posted where we uh, we are compassionate, professional, in delivering quality services. We integrate comprehensive services across the family service spectrum. We work in partnership with the Department of Family and Protective Services in order to deliver our program. The agency does have preventative services, also preservation reunification services, kinship and unrelated adoption, and post permanency services. Our program model, again, it's predominantly kinship. So we have a kinship navigation program for our um, preventative services. For our preservation reunification, we do work with biological parents or the parents that have the CPS case by offering the services that are outlined. For our kinship families, we have the home licensing as well as other supportive services because we have a behavioral health arm to our agency, and so we've our modality that we use is trauma focused CBT in all of our overarching treatment and interventions. We have post permanency services for our kinship caregivers. So after you've reached PMC or adoption, you can continue with us for the supports that may be needed. And then finally, we have kinship research. Have a kinship lived experience lab that I'm the principal investigator of, and we have successfully ran 2 research studies, working on the third. And again, all this is to influence policies and practices within child welfare, specifically for kinship caregivers. Um, Theory of change. Again, we want to reduce with all our program models. We want to reduce the use of stranger foster care or congregate care, and increase the use of utilizing placement with the family of origin, or at least someone that the child is familiar with. And so that's our overall goals at Monarch. Again, talked about the prevention services. Our prevention services, we have a kinship navigation program in which we provide case management, advocacy for the guardian, monthly virtual parent support groups. We also have psychological services and crisis interventions. And we, every quarter, We host a family event for all of our caregivers, all of our kinship caregivers. Whether you're informal or formal, or you've gone through the licensing process or not, we do host quarterly events. Reunification. So this is our preservation, like I was just talking about, for the biological parents. So those that are trying to get their children back into their care, we do have the psychological services, substance abuse treatment, uh, domestic violence groups, intensive case management, parenting, and also supervised visitations. We offer to biological parents. So in some cases, we work with biological parents and the kinship caregiver and the child, of course, with all of our program models. Kinship permanency. So with the kinship permanency, we bring families through the home licensing process. And since we work with kinship families predominantly, we have perfected with helping that specific population with completing. So we have like a 98% completion rate. So if you are to get services or become or go through the licensing process with Monarch, there's a 98% chance if you go through it, you will successfully go through it, because we have perfected our service model to work with kinship caregivers. We have an extended foster care program for kinship caregivers. Sometimes the child doesn't want to be adopted, or it's thought that they're 17, 18. Permanency is not an option. So we do provide services and support for extended foster care, or youth between the ages of 18 and 22 that want to remain in a relative home and receive the financial support, but also we have educational support where every month we have life skills classes or support groups. Well, we do offer the support group every month, and therapeutic services and workshops. And once a year we do host college tours where we take the children to different colleges, and not just colleges, but also trade schools or certification programs, so that they're able to explore their interest. The next specialty program we have is Kinship Family Foster Care. Kinship Family Foster Care program is for our more intense kids, age 3 to 17. And so this is more intense services towards for the family. The reimbursement is higher for the relative caregiver, also, but also they're available. All these supports to your left and right are available. So for the child, sorry. I said to your left and right, but to your right, where we support through the home licensing process, of course, but also you get mental health services, family therapy, behavior skills training, CANS assessment, intensive case management, crisis team, availability 24 hours, shared parenting program, kinship caregiver support groups, and parent coaching specialists will work with you, and post permanency services is still available once permanency is achieved. And again, the reimbursement is higher for those families that qualify for the kinship treatment family foster care program. And again, it's for more of our intense children with severe behavior issues. And so it's just trying to get them to stabilization so we can get to the road of permanency. Post-permanency services. We've had a post-permanency program for the last 8 years. And so we offer for all of our families that have gone through Monarch as their permanency, for their permanency to achieve permanency after licensing, or licensing to achieve permanency. We do have quarterly family events. You still have access to case management, information and referrals, psychological services, access to the crisis team if needed. monthly support groups and also respite. We can provide respite homes for if the families need breaks. And then finally, our research. So we do have research that we've conducted. This was the first research. It's called Grandma Needs Help. And so we're looking at the importance of social support in kinship families and what do they um, feel that what is, what is social support, or how can it, how is that described and determined what is needed in regards to social support. And so we ran that study in 2019, published it in 2022. Currently, we are finishing up a second study looking at family separation in the foster care system, but mostly about obstacles of supported permanency. And so, what are some of the obstacles we're going through the licensing process? Because most of our kinship caregivers do not go through the licensing process. And so, what we want to do is we want to see how we can advocate to improve the conditions and the perception of this process so that more kinship caregivers decide to participate in the home licensing program. And so this research will influence, well, first off, it will make those aware within the child welfare system and other stakeholders what are the issues, and then then it will hopefully influence policy and practices in the future. And that's it. That's it. That's all. That's Monarch Family Services. And we're located in Region 6. We cover all of Region 6. We also are in Region 7 as well, which is Austin area. Region 6 is in Houston area and surrounding areas. And so we were able to serve families in all the counties in Region 6 and counties in Region 7 as well. All right. As we put the last of the slideshow up, I want to point your direction to different statewide resources for kinship families. And so we do have, so we're switching gears actually. So this is just statewide resources for employment, family help, link Texas law, navigation programs, and we have sectioned them off in the different regions, whichever you pick one that's closest to you. Texas Grandparent Raising Grandchildren Project also has good guidance and can answer questions. And Family Support Services website also gives good guidance. All right, that concludes our presentation. If you have any